Let's talk about congestive heart failure. Is a syndrome caused by an impairment in the heart's ability to fill with and pump blood. As you know that the heart is a vital organ which pumps blood to different parts of the body. Yes, it has four chambers, two ventricles and two atrium. Normally, this has to be filled and eject blood in a proper way in order to give your body a normal blood circulation. Here in congestive heart failure, heart cannot pump blood well enough to give your body a normal blood supply. Then what happens? If the heart not able to pump in proper way, the blood and fluids start to build up in other parts of your body. Most of the time, it collects in your lungs, legs and feet. Sometimes you might have a doubt that whether the heart is working or not in this condition. Yes, your heart is still working. But here, the heart is failed in pumping blood to different parts of the body. Heart failure, also known as congestive heart failure or congestive cardiac failure. Why this term congestive? Congestive refers to resulting buildup of fluids in ankles, feet, arms, lungs, or other organs. So here, as we said before, heart is failed in pumping blood to different parts of the body and result in fluid accumulation. That's why the heart failure is also known as congestive heart failure and congestive cardiac failure. And do you know, heart failure is a lifelong condition which requires timely medical attention. Let's come to the causes of congestive heart failure. The heart is a strong muscular pump a little larger than your fist, which pump blood. Heart failure is caused by weakened, damaged or stiff heart. In this condition, there is an impairment in heart's ability to fill with and pump blood. How these heart muscles getting weak or damaged? It can be caused by several factors like coronary artery diseases and heart attack, which is the most common causes of congestive heart failure. Coronary artery diseases results from the buildup of fatty deposits in the arteries. This is known as atherosclerosis. Then what happens? This atherosclerosis, which will narrow the artery and reduces blood flow, can lead to heart attack. This heart attack will damage heart muscles due to inadequate blood supply to coronary artery. As I said before, in CHF, heart muscles getting weak or damaged. Hope you understood how these causes leads to congestive heart failure. So far we discussed about the most common causes. The other causes are hypertension, heart valve diseases, inflammation of the heart muscles called myocarditis, congenital heart defects, arrhythmia, long-term diseases like diabetes, HIV infections, overactive or underactive thyroid, then severe infections, allergic reactions, a body mass index BMI higher than 30, use of certain medications, and tobacco and recreational drug usage. All of these causes creating extra work for the heart. Our heart is start to work continuously from when we are in mother's womb without rest. So you can just imagine how the extra work will affect the heart function. Always remember, left-sided heart failure is the most common cause of right-sided heart failure. CHF is not happen within one day. The above causes makes the heart stretches to contract more strongly and keep up with body's demand to pump more blood. Over time, the heart too enlarged. As you can see in this picture, the difference of normal heart and heart in CHF. Also, the body tries to compensate in other ways, like kidney retain more salt and water rather than excrete it through urine, leads to fluid buildup. Next is the signs and symptoms of CHF. It can range from mild to severe. It includes shortness of breath with the activity or when lying down, heart palpitations, chest pain, swelling in the legs, ankles, abdomen, weight gain from fluid buildup, bloated or hard stomach, loss of appetite and nausea, a dry hacking cough with white or pink mucus with the spots of blood, or foamy mucus, and wheezing. Also, patient may experience difficulty concentrating or decreased alertness. Let's see the diagnostic measures and tests. History collection and physical examination. Through auscultation, we can find out murmur sound. Then blood test. Check for levels of protein. Then chest X-ray to check condition of lungs and heart. ECG. This is a quick and painless test which measures the electrical activity of the heart. Echocardiogram. Here check for ejection fraction. If it is less than 50%, it's indicating heart failure. Then cardiac catheterization, cardiac MRI, cardiac CT, treadmill stress test. It shows how heart responds to physical activity. Next, MUGA, multiple gated acquisition scan. This is an imaging test that checks how well heart pumps blood. It also measures ejection fraction. And the last one is genetic testing. What are the types of heart failure? According to American Heart Association, it can be divided into four. Right-sided heart failure. It affects the lower right heart chamber called ventricle. Here, fluids may back up into belly, legs, and feet, causing swelling. Left-sided heart failure. It affects left ventricle. Here, fluids may back up lungs, causing shortness of breath. Then, heart failure with reduced ejection fraction is also known as systolic heart failure. And what is ejection fraction? This is a measurement expressed as percentage of how much blood the left ventricle pumps out with each contraction. Here, the heart failure with reduced ejection fraction or systolic heart failure is a type of left-sided heart failure. What happened here? The left ventricle cannot squeeze as strong as it should, so that the heart cannot pump enough blood to the body. The last one is heart failure with preserved ejection fraction, is also known as diastolic heart failure. This is a left-sided heart failure. Here, the left ventricle cannot relax or fill fully. In diastolic heart failure has a problem with filling with blood, whereas in systolic heart failure, the left ventricle cannot squeeze properly and affect heart blood pumping function. Let's see the stages of heart failure. It's very essential to understand about it because the treatment method will be according to stages of heart failure. The first stage, stage A, pre-heart failure. Here, you are at high risk of developing heart failure because you have a family history of CHF, or you may have one or more medical conditions like hypertension, diabetes, coronary artery diseases, metabolic syndrome, or history of alcohol usage. Then stage B. Here, left ventricle isn't working well and is structurally abnormal, but you have never had symptoms of heart failure. Next one, of course, stage C. Here, the patient have a congestive heart failure diagnosis and currently have or previously had signs and symptoms of the condition. Then stage D and reduced ejection fraction. Here, the patient experience advanced symptoms that do not get better with the treatment. This is the final stage of heart failure. Let's move to treatment of heart failure. As I said before, treatment method is according to the stages. So first, the stage A. Again, I am saying what is stage A. Here the patient is at risk of heart failure because there is family history of heart failure or history of other diseases like hypertension, coronary artery diseases, or cholesterol. As such, the treatment for stage A includes regular exercise like walking every day, no tobacco products, no alcohol or recreational drugs. Then medication for disease condition like hypertension and cholesterol. Then ACEI, that is angiotensin converting enzyme inhibitor. Also, ARBS, that is angiotensin second receptor blocker. If you have DM, CAD, that is coronary artery diseases, and hypertension or other vascular or cardiac conditions. Next, treatment for patient with stage B heart failure. It includes treatment for stage A, ACEI or ARB inhibitors if your ejection fraction is 40% or lower. Then beta blockers, just an example, metoprolol or bisoprolol if you had heart attack or your ejection fraction is 40% or lower. Also, aldosterone antagonists known as potassium sparing diuretics, just example, spironolactone if your ejection fraction of 35% or less and had a heart attack. Then angiotensin receptor neprilysin inhibitors as blood pressure medication, and possible surgery or intervention as a treatment for coronary artery blockage, heart attack, and valve repair. Stage C treatment includes treatment from stage A and B, sodium glucose transport 2 inhibitors. It will help to lower blood sugar, hydralazine and isosorbide dinitrate if you have severe heart failure symptoms, or beta blockers and ACE inhibitors haven't helped. Then diuretics, water pill to prevent fluid buildup. Example, Lasix, restriction of sodium in your diet, fluid restriction, possible cardiac resynchronization therapy, and ICD. Stage D treatment includes treatment for stage A, B, C. In addition, it includes heart transplantation, ventricular assist device, heart valve repair or replacement, heart surgery like coronary artery bypass graft, continuous infusion of positive inotropic drugs. It will help the heart pump blood better and maintain blood pressure, and palliative care. Next, the treatment for stage C and D with a preserved ejection fraction. It includes treatment for stage A and B. Also, it is very important to manage the health condition that cause heart failure. What are the complications of heart failure? Kidney damage or failure, other heart changes. It can cause changes in heart size, function, MA damage, heart valves. Next is liver damage. In heart failure, the heart is not pumping properly. So, it will cause fluid buildup or backup. It will put too much pressure on the liver. The fluid backup causes scarring, which makes more difficult for the liver to work properly. Whenever you are learning heart failure, just keep in mind about the concern fluid buildup makes more complications. Other complications include respiratory distress and pulmonary edema, also due to fluid overload. Then sudden cardiac death due to irregular heart rhythm, blood clots which can lead to pulmonary embolism or stroke. Then muscle wasting. If this video really helps you, please like, share and subscribe my channel. Thanks for watching.